This Fed Gov Today program is sponsored by EY. On this edition of Fed Gov Today with Francis Rose, getting the next big transformation right the first time. Healthcare tech gets a makeover inside HHS and making the people piece of healthcare work better. Welcome to Fed Gov Today in Washington, D.C., on YouTube and around the world on the American Forces Network. I'm George Jackson. Francis Rose is off today. The Office of Personnel Management will lead a transformation of more than 100 HR systems across government into one. It's the first of what the Trump administration promises will be a series of system modernizations, major ones. George Kaczmarskyj is Principal, Government and Public Sector at EY. Sir, welcome.
Wonderful. Thank you for having me.
Let's talk LCAPs, low-code application platforms. What are those? How does it sort of weave into HR, finance, IT, other government operations?
Yeah, great. George, thanks for having me. It's good to be back. You know, low-code application platforms have really taken a change to the way we do application modernization. We saw a lot of adoption in the commercial sector, financial services early on, and it gave another option on how to approach doing technology development. And so we saw in banking, for example, when banks merged together, we had to rationalize two different systems. What's the best way to do it? And you had lots of options. We could custom engineer code. We could buy a platform that existed that had the functionality in ERP or a core banking system, or we could take advantage of low-code application platforms. And it really came down to what use case you were trying to solve for, which platform you used. But the interesting thing about the low-code platforms was they brought a speed of development that we didn't see in the other areas. And so, you know, the biggest advantage and the biggest reason we saw commercial uptake in it, and now we're seeing it in government, is because the minutes to mission matter. How long it took for us to get from an idea, a requirement, to production is accelerated through a low-code platform, and that's where it got a lot of attention. But then there were other variables that became interesting. We had a real big resource gap in finding developers in financial services. Finding full-stack custom engineers that worked in, you know, the coolest technologies was difficult. They were expensive. They were being taken by, you know, the innovation firms, by the product development firms, by Silicon Valley, and getting and attracting them was difficult. You paid a premium for it. But the cost of entry into a low-code platform for a developer was low. And so we were able to attract and build business applications quickly with those platforms. So those were a couple of things that really got attention and brought the industry to using it, and then it's become a mainstream capability.
You referenced, didn't use these words, George, but speed to mission. Another thing in studying up on LCAPs that I kept coming across was the phrase consistent user interface. Why is that important?
Yeah, so when you are a developer and you're trying to develop a custom application, you have a lot of liberty in how you can design that. You have flexibility, and you may be really good at it, or you may not be. The low-code platforms have inherent consistency in the user interface. And what's really fun about that is you can drive stakeholder engagement throughout the application development process, because say you ask me, I want this requirement, I can very quickly in the low-code platform prototype it right here in the meeting in a couple seconds. And so what that allows us to do is to build the application not just faster, but according to what your expectations are. And then because of the design of the platform and the standards that are put in place and the commonality of the screens, it all flows through equally through the platform, and so it makes it a little easier.
I mentioned HR at the top, certainly applicable there, but as we were talking before we went on the air, you've done a lot of work on these integrations in sort of the FedFin, the federal financial space.
Yeah.
Help us, you know, for those agency leaders, avoid some common pitfalls for integrations. What should they avoid?
Yeah, so the problem with integrations is if you have to build 1,000 of them. We have thousands of systems in the agencies, and we want to take one out and modernize it and put a new one back in. I have to integrate it with hundreds, thousands, a couple, it doesn't matter, but that's all effort. And that is all, an opportunity for failure, an opportunity for mistakes, et cetera. What's nice about some of these low-code platforms is they come with pre-built integrations to the most prevalent products out there. So if you have a CRM, a manufacturing system, an HR system, a financial system, and I need to integrate and talk to it from the application, I have pre-built integrations available to me, and then I don't have to rebuild them from scratch. Getting that right is important because that's where the data exchange happens. That's where all the business rules get confirmed between the two systems, and it's ripe for mistakes. So if I can have someone that's already pre-built and tested and just use it, it helps a lot with the process.
If I'm in IT and I don't want to remake the wheel on some of these issues, can I go to a different agency and leverage the way that they've been coding in order to do this at my organization? And what I'm getting at, George, is like reuse. Once these are built successfully, are agencies able to take cues from one another so that what's already been built can be leveraged with a minimal amount of work?
That's the aspiration. That's what we really hope to get to. I think this is one of the interesting learnings we've seen over the years of using low-code platforms. Is just because it's low-code doesn't mean I can't build a bad application, right? And that can be daunting. So on the concept of reuse, one of the lessons learned we have is from the very early days, you want to go ahead and design an application for reuse. Now, whether it can be reused across agencies depends on the application, but certainly within an agency and across a portfolio of applications in the same domain or same function, that becomes a real big opportunity for us to take advantage of.
As we close, artificial intelligence, elephant in the room in all of these conversations, why is it important to LCAPs?
So the artificial intelligence thing is becoming really pragmatic right now in application development, whether it's in low-code application development or custom. We are seeing significant gains in productivity tools being made available to the developers. What's nice about the low-code platforms now is they are natively integrating those capabilities into their product across the entire software development lifecycle. So for requirements, for coding, for testing, even in production, those tools are now available, and I can take and do things in a fraction of the time I did before. I can load user requirement documents, I can load screens, I can load data into the tool, and it can start by building the application, and then I can tweak it and take it forward. So that's a trend that's available now. Most of the low-code platforms have that capability being developed or already pretty well along, and we can use that. We can see gains from that today. The other interesting development we're seeing, and I don't know that it's completely mainstream, but I would think in the next 12, 18, 24 months, we're seeing utilities come available in the market that allow us to ingest an existing application in one low-code platform, bring it in, convert it, and get you ahead into a migration into another low-code platform. And why that becomes really important is it provides an agency flexibility, but more importantly, it reduces the possibility of vendor lock risk long-term. So that's an exciting development. More to come. I'd cautiously evaluate it and expect that it'll be available to us soon.
We'll stay on top of it with George Kaczmarskyj, EY. Sir, thanks so much.
Wonderful to be here. Thanks.
You can read more about system modernization on today's show page at fedgovtoday.com. Up next, healthcare tech gets a makeover inside HHS. Fed Gov Today with Francis Rose continues in a moment.
Innovation doesn't wait, and neither do we. At Maximus, we solve problems. Streamlining operations, delivering solutions at speed and scale that drive measurable results. From strategy to execution, we simplify complexity, building trust through expertise and innovative technology. Every service, every time. Efficient government delivered. We don't follow innovation, we drive it. Maximus.
Welcome back. The Health Resources and Services Administration is rolling out a series of technology modernization efforts in the coming months. Those programs are the latest in a series that impact several of HRSA's mission areas. Thomas Engels is administrator of HRSA. Sir, thank you so much for being here. For the uninitiated, and I have to admit, I would count myself in this group. Talk a bit about HRSA's mission. Very unique. It surprised me based on how many people HRSA serves on a daily basis. Talk about the mission.
We're a very broad organization. We have a number of programs that actually touch patients. We're actually one of the few programs within all of HHS that actually touches programs. But we serve geographically and medically underserved areas. We have the federally qualified health centers. We have the Ryan White HIV/AIDS program. We have the leprosy program in this country. So we serve a number of very unique programs, and we touch a lot of lives.
I read more than 30 million people. Some of those communities, a lot of them are economically, medically vulnerable. Talk about some of those vulnerable communities that you sort of target in a really positive way on a daily basis.
We serve through the federally qualified health centers. We have about 1,400 sites, facilities across the country that we actually provide funding to. Out of that, there's about 15,000 sites that those federally qualified health centers actually operate. And as you noted, they served in 2025 32 million patients across this country. That's a 1 million increase from the year before. And they're the only service point for a number of these patients. Without that, they would not have access to health care. Secretary Kennedy has made it a priority. We want to reach these patients. We want to be able to provide them with good nutrition services, dental care, mental health services, substance use orders. We want to be able to touch their lives to help them become better parents, better working production members of society, but also to provide them the care and the dignity that they deserve.
Give me and our audience a bit of a history lesson, sir, if you would. Like, this isn't your first rodeo. You were a member of the first Trump administration, and some of the top priorities at the time were the opioid crisis.
Correct.
Certainly the COVID-19 pandemic. You're back, second Trump administration. How do those priorities from the previous time in office for you compare to some of the key priorities that you're taking on now? What are those priorities?
You're correct, George. This is my second go-around as the HRSA administrator, and I'm honored to be back as the HRSA administrator. We started a number of the programs that you're actually seeing us implement today. We started in that first term. COVID came along and stopped a lot of this, but COVID was not the end of HRSA. COVID actually gave us an opportunity to really show what HRSA could do. At the time, Secretary Azar called me and said, we're thinking about putting the Provider Relief Bureau out at HRSA. And I said, I think we can do that. And he goes, that's not the answer I'm looking for. And I said, Mr. Secretary, we can do that. And we operated a $178 billion program out of HRSA. We made sure providers were receiving payments. We made sure that patients were still able to see their providers. All of that was being operated through HRSA. But prior to that, some of the stuff that we're actually doing now as it relates to organ transplantation and the modernization of that system, we started under the first Trump administration. President Trump made that a priority. Another program that he made a top priority was ending the HIV epidemic. Today, President Trump wanted us by the year 2030 to be at 90% viral suppression rate for somebody with HIV/AIDS. We were able to get that. Today, we're at 91.4%. That's a significant increase. That's a significant accomplishment. And we actually beat the president's goal by 4 years. President Trump, Secretary Kennedy have made these priorities, and we're going to continue to make those priorities.
You mentioned Secretary Kennedy, the Make America Healthy Again, or MAHA initiative. Talk a bit about HRSA's role tied to that. I mean, you're part of HHS. Secretary Kennedy, that's his signature initiative. What role does HRSA play in shepherding that through government?
We are geared for the Make America Healthy initiative because we have a number of programs that actually touch patients. So we actually have programs that teach patients about nutrition through our federally qualified health centers, and the 1,400 of them we have across the country. We actually are able to help teach patients nutrition services, help them understand how good nutrition leads to good health outcomes. We also have programs that it deals with maternal health programs across the country, where we can help expected mothers and newborn mothers become good parents and good mothers. They have a very difficult job at times. My mom had a difficult job raising me. I know she did, because she talked to my dad about it numerous times. But we also made sure that we're making sure that they have all the resources that they need. So, for example, we have a hotline that we would like, and everybody and all your listeners to know about. That is 1-833-TLC-MAMA, TLC Mama. It's open to anybody that wants to call. We have newborn mothers that are just having challenges. Could be postpartum depression, could be multiple things. We encourage them to call, use that number, talk to somebody, and then we can help them get help. Whether it's going to one of our federally qualified health centers, whether it's going to one of our Ryan White HIV clinics, or if it's going to one of the federal hospitals that the Federal Office of Rural Health Policy that operates through HRSA. And we are the only office within HHS that deals solely with rural health issues. So we incorporate a number of different areas. And then when you add all that together, another major component that we have the only office that deals with telehealth services. And we try to incorporate all of our telehealth technology and telehealth expertise to making sure that patients can be monitored, patients can get those services. I come from Wisconsin. Wisconsin, like we're seeing here, gets a lot of snow in the wintertime. And when northern Wisconsin, somebody's waiting to get an appointment scheduled, and all of a sudden the day that they're supposed to have that appointment, and they have to come down to Madison for it, we get a snowstorm and they can't make it down, we actually help them now with telehealth services to make sure that their providers can be connected and their services can still be offered to them.
Tom, you mentioned rural health. That's another really key focus for this administration. $50 billion rural health care in the big, beautiful bill. I note that CMS oversees that program, but how does your office help facilitate? Is it logistics? Is it expertise? Is it all of the above?
All the above. One of the first calls after the bill was passed, and CMS was authorized through the Rural Transformation Fund to actually come up with a program and make sure that states would know how to access that money. One of the first calls that Dr. Oz made, who is the CMS administrator, he called me and said, "Tom, we need your help in this." Reason being is because the Federal Office of Rural Health Policy at HRSA has all the expertise. We know how to set these programs up. We understand how these programs operate. We understand how states utilize these programs. He called us. We've had a team working with his team from the very beginning, and they're continuing to work for it. They're evaluating plans. They're helping advise Dr. Oz on ways that they can implement these plans. We want to make sure those dollars are being utilized in the best possible way.
Tom, stay right there. I have so much more I want to talk about with you. You can read more about modernization at HRSA on today's show page at fedgovtoday.com. Up next, making the people piece of healthcare work better. More with Director Engels when Fed Gov Today with Francis Rose continues in a moment. Welcome back. The technology you learned about earlier in the program is only one piece of how HRSA is trying to modernize. It's modernizing its people, too. More now with Tom Engels, administrator of HRSA. Sir, where we left things off, we want to shift gears right now, full bore into modernization. I note that electronic health records, or EHR, big part of your background, big part of the work that you did for the state of Wisconsin. Talk about the impression that you got rejoining HRSA relative to EHR. What are the challenges? What are the opportunities there? What are you hoping to do with the organization?
Well, when I was Deputy Secretary of Health in the state of Wisconsin, we had actually operated facilities, and none of them had electronic health records that actually would talk to each other. We modernized that system by making sure that they would start to talk with one another. Same situation here, but we have 1,400 federally qualified health centers across the country. All of them operate on different systems. We're trying to find ways that we can help and use systems like Epic, for example, to have them all connect together. But all these systems are really expensive. Health centers are operating in very tight budgets. We want to make sure that there's ways that we can actually bring about this technology, but make it so it's financially viable for them. We were at a rural hospital in Louisiana last week, and we actually got to see some technology updates that this hospital in rural Louisiana had implemented that my chief of staff, Margaret Bush, that was with me, hadn't. She worked in a hospital in New York City, didn't even see some of this technology there. So we're seeing this, and it's simply because it's in a rural area, it doesn't mean it's always going to be mom and pop type operations. These are very sophisticated medical providers, but we need to make sure that they have the tools necessary to help serve their patients.
What types of information, what contributions would be most beneficial as your counterparts across the Department of Health and Human Services investigate that EHR issue, like from industry itself? What do you want to hear from them? What do you want to know from them?
We want to know what industry can actually help us with. There is not one solution that's going to fix everything for us. Holly Wall, who also works on my staff, and Margaret Bush is on my staff, we're all working together to make HRSA operate as one HRSA. Because within HRSA, we want to make sure all of our bureaus and offices work together to make sure that we're utilizing the taxpayer dollars, which we are the custodians of, to making sure that we're utilizing those in the best possible way. Are we making sure that our health workforce division is actually talking to our Bureau of Primary Care division? But then when we expand that and go out beyond, are we making sure that other offices within HHS also understand what HRSA does? By doing that, we're going to incorporate some of these changes. So, for example, our Federal Office of Rural Health Policy is working in areas in the South and also in the Northwest part of the United States, where we're consolidating and having them utilize a system where an Epic license might be provided to one provider, but that provider is able to use it for multiple providers in that area for an electronic health record system. It holds down costs, but it's also bringing about better patient care because now all those providers know how to take care of that patient.
Before we got rolling here, one area you told me you personally are really rolling up your sleeves relative to modernization goes by the acronym OPTN, the Organ Procurement and Transplantation Network. Did I get that right?
You got it correct.
Tell me about the modernization effort there and what fruits could that bear for the agency writ large if it's done in the right way?
Well, I'm really glad you brought this up because this is one of the unique programs that's at HRSA that people really don't understand, but we have the Organ Transplantation Network within HRSA. And I think some of your viewers have probably heard some very troubling stories over the last few months about where patients were being taken in to have organs recovered prior to their death. And so our staff has been investigating a lot of this. Secretary Kennedy and President Trump have made it a priority that we are going to bring about new technology and we're going to modernize this system. We started this in the first Trump term and we're going to complete it during this term. Secretary Kennedy is the first secretary to ever decertify an organ procurement organization ever in the history of this country. And he did it at the recommendation of both Dr. Oz and myself because there were so many things going on with this particular organization that we said it can't be fixed. And he decertified it. But we are going to make sure that we're putting together a system that brings about integrity, trust, and the impeccable attitude of the number of the providers that are using this. Patients that make that very difficult decision and the family members that they have, that they want to donate their organs, they need to be treated with respect and integrity. The families that are receiving those organs have an ability, want to be operate in a system that is built on trust. If that organ is available to a mom or a dad, it should be made available to them. And we've heard a number of times where it's allocation out of sequence, was something some of your viewers may have heard about, where an organ becomes available and it gets shipped off to other areas. We want to make sure that there is a process by which those organs are being transplanted into patients that actually deserve them. And finally, it also puts the integrity and the ethics and the morals of the practitioners that are using this system. They have taken an oath to take care of their patients. We want to make sure that they have a system that's doing exactly that.
Talk to me a little bit about the technology, Tom. I know you're not a technologist. You have a chief information officer and a chief information security officer for that, but artificial intelligence is also a priority across the administration. It's a big part of a lot of these modernization efforts. Is the future of artificial intelligence a factor inside of this OPTN network and other big modernization initiatives for HRSA.
It absolutely is. And there's a number of different ways. HRSA is a grants operating program. We have a number of grants that go out all across the country. We're utilizing AI and other technologies to help us evaluate those grant applications when they come in. We're making sure they meet the priorities of Secretary Kennedy and of President Trump and of this administration. And by doing that, we're able to help streamline the process, find true systems, find efficiencies within those systems, but also help us identify areas that we never thought about maybe go into before. There are a number of patients and a number of programs across this country that they might be sitting around a coffee table or sitting around a kitchen table and say, we got an idea of how we should do this. We want to take pilot programs, model them, create them, and then be able to take them across the country. But under the current system, the way we have it now, everybody that always gets a grant always seems to get the grant. We want to break that system, and that's something that we're taking a look at. We're looking at every dollar that we put out, is it being used in the best possible way? I believe with the AI systems that we're utilizing and utilizing through the department, we're going to be able to accomplish that.
Great message to close on for our audience here in Metro DC, around the world on the American Forces Network with HRSA Administrator Tom Engels. Tom, thanks so much, sir.
Thank you, and I would like to thank our members of the military for their service and also thank all of our federal employees.
Good bunch. You can read more about all the topics we covered with Tom on today's show page at fedgovtoday.com. The program continues in a moment. Stay with us.
We like to get beyond compliance with our own DoD data strategy that came out in 2023. Curation, automation, and governance is our key goals to that strategy. With regard to AI, it's a critical enabler because given the volume and the complexity, you're going to need that to assist with automation.
Automatically recognize, first of all, every character that's on the piece of paper. Handwriting recognition today is something that was not available back in the day. Pretty much auto tagging the data, which means what is important in here, what are the people, places, things, the content, the context of what we're talking about, the key, the salient points in each of these, a summary of that document, and AI can do all of that.
Welcome back. In today's event spotlight, innovation in healthcare delivery and technology is in focus this coming Wednesday, February 11th at the ACT-IAC Healthcare Innovation Summit. You'll see keynotes from leaders at CMS, the Food and Drug Administration, NIH, and a lot more. It's happening in Reston at the Carasoft Conference and Collaboration Center. Read and learn more about it. Register at fedgovtoday.com/events. FedGov Today TV returns next Sunday morning at 10:30. I'm George Jackson, in for Francis Rose. Thanks for watching. Have a great week.